a community-based organization, how do you measure the success and impact of your project on the lives of these young women and adolescent mothers?
So how we measure our success? We measure our success according to the number of success stories that we have. So if we have an initiative and we have many girls go back to school, many teenage mothers go back to school, that is a success to us. So we measure our result based on the number of success stories that we have. How many have we been able to equip with economic skills, and how many are using these economic skills that we've equipped them with? How many have been able to go back to school, and how many have been able to just get integrated back with their families, and their families have accepted them back? So we measure our results based on the number of success stories that we have.
Since inception, direct and indirect beneficiaries, can you put a number to it? How many girls and young women you've been able to reach?
Since we engage a lot of community members, so it's gonna be hard for me to come up with figures, but I will just say maybe 2,000 there. Yeah, community members that we've engaged and have benefited from our initiatives. Yeah.
That's a good number. So reproductive health access is a recurring issue across the continent in Africa. What barriers are you seeing in these communities you serve?
Barriers to access to sexual reproductive health. I would say in rural communities, the local health facilities, many a times they are not well equipped with the services or the medication or even the contraceptives. So we would say the local health facilities don't have enough resources or enough amenities. Also, another challenge would be there are so many stereotypes, how would I say, myths and misconceptions around sexual reproductive health services. So you'll go to a community and you're trying to educate them on maybe this contraceptive, but they already have a myth around it, like that contraceptive. They will tell you this contraceptive, if you use it before you give birth, you'll become barren, or this contraceptive makes you get fat, or this contraceptive, we have been told if you use it, you want the babies that you'll be giving birth to will have abnormalities. Yeah, so there are so many myths and misconceptions around sexual reproductive health services. We'd also say the women, and also lack of male involvement. Before I say what I want to say, lack of male involvement in SRH. The men are not willing to engage in it because they believe things to do with even maternal health, that is a woman thing.
Okay, so they should just deal with it directly and they don't want to be involved.
Yeah, they don't want to be involved. If you tell them, can you accompany your wife to the health facility? They're like, no. No. That is not our thing. Culture prohibits that. And now if you tell them the various options now, because you can tell someone now you have enough children, and with your economic status, having more is going to be a burden to you. Maybe as a man, you can try vasectomy. They're like, no, that is that is a Western thing. You have come here to colonize us. You're not a good person. So
you face a lot of cultural barrier. Speaking about the myths and taboos, do you have in Kenya and communities you've worked, do you have any stigma and taboo around menstruation or menstrual health hygiene? Do you face anyone?
Yeah. There is a lot when it comes to menstrual hygiene, especially for rural girls and also just women. It's a lot for them, and there's so many myths around it, and there's so much stigma when it comes to it. You'll find a girl has started her periods or menstruation, but she cannot share it with anybody because it does not feel okay to her. She does not feel safe enough to share with someone because there are no conversations around it. The conversation you'll only get is once you start your period, just know you can get pregnant anytime. That
Pregnant.
is the yeah, that is the only thing your parents will tell you. But now we have been trying to bust the myths, and we have been trying to just ensure we end period poverty, because with period poverty, that is what has led to an increase in teenage pregnancies, because that border guy can buy you that border guy can buy you a sanitary towel while your mom does not afford it, or that perpetrator can just lure you and give you 80 shillings and you will buy a sanitary towel. So there are so many myths around it, and there is so much stigma, and people like it's not once you start talking about it, the people start shying away from
Away
it.
from it.
But we are trying to bust the myths. We are busting the myths when we do our initiatives, and we also just distribute dignity kits that have sanitary towels, that has panties and everything, to just ensure the girls in the community are safe enough, and we are normalizing the conversation around menstruation.
Exactly.
Yeah.
That's very good on of Rural to Global Organization, integrating
Yeah.
the young girls back into the society and helping them further their education. That's a good thing.
Yeah. Yeah, we want to see women empowered, because rural communities, patriarchy and misogyny are such a big thing, and they are fueled with culture. People may say this is just our way of life. It's our way of life for a boy child to be more educated than a woman. It's our way of life for a woman to do all the domestic household chores. It's our way of life for a woman not to inherit land. Widows in rural communities have faced such a significant barrier. Once your husband dies, you're subjected to so much cultural
Wow,
retrogressive
it's
thing.
so interesting to find out that East Africa, Kenya, and Nigeria share a lot of similarities when it comes to cultural limitation,
Yeah,
gender inequality when it comes to women. Because all these things you're saying, I can relate perfectly because based on my experience, years of experience on the field, and speaking to women when I go to rural communities, they share the same thing, they experience the same thing. So
yeah,
it's so funny how all these things cuts across the continent, and
yeah,
that shows we still have a lot of advocacy awareness to do from the rural even up to the urban, and also make some policy changes to rewrite this narration.
yeah, yeah. That is so true. We have a lot of work to do. So much when it comes to gender equality advocacy. We have a lot to do, and we just hope that the thing with the African countries, when you start a movement, they say that is a Western thing. So when feminist movements arise in Africa, you are told that is just a Western thing. It's not an African thing.
African thing.
Yeah. So I hope there'll come a time maybe in our societies where gender equality will not just be a war of sexes. Yeah. It won't be a war of women and men, but it will just be something that will be accepted, that there is need for equality to exist in a society. There is need for women and men to have access to things. There is need for us to just end this retrogressive culture that puts the lives of women at danger, puts the lives of young children at risk. And we just believe that this advocacy, stakeholder engagements, policy advocacy, and everything will work out someday. Yeah.
Hopefully, and that is why we keep having conversation around it, because the more we
Yeah.
talk about it, the more we hope things will change.
Had so much stories when it comes to gender-based violence, and
A
how
lot.
just a lot, and we just realize how much culture is so retrogressive and so harmful when it comes to women. and there is nothing that protects the women. It can protect a man, but when it comes to a woman, it cannot protect a woman. And
Exactly.
it's so sad.
And that's why actually I'm so passionate about this, talking about these issues, creating awareness. Let's talk
Yeah,
about it. Let's bring it to the front burner and not just pushing it aside, because
yeah,
this, when especially when you go to the field, when you go to communities, it's totally different
yeah,
from what you experience in the city. And this
yeah,
and these young girls and women are just suffering. They're just suffering in silence. They don't even know what to
yeah.
do, and it has become so much part of them that some don't even see an issue with it. Like, okay,
So true.
this is culture, passed from
Yeah,
generation to generation, is now a norm, and they feel,
yeah.
well, this is it. This is us. There's nothing we can do. Thanks so much, Faith. So we're actually coming to the end of the podcast, but yeah,
Okay.
maybe in a sentence or two, I wanted to say something about your organization, about yourself, like a way of, okay, this is what we do and this is what we've done.
So we are a women-based organization in Kakamega County. Always feel free to reach out to us. Follow us on our social media platforms everywhere. That is Rural to Global Organization. Yeah, and we will be happy to collaborate and learn more and interact. Yeah. So together, let's end gender-based violence. Together, let us create a barrier-free society where women and girls thrive. Together, let us champion for gender equality. Together, let's stop war of sexes. Yeah. So
Thank you.
that is all.
Thank you very much, Faith, for that. Now, what an inspiring conversation, from confronting gender-based violence to equipping young women with knowledge and power. Rural to Global Organization reminds us that change happens when we start at the community level with empathy, intention, and courage. By creating safe spaces, empowering voices, and giving girls the tools they need, this organization is shifting the future for hundreds of young women in Kenya. Ashante Sana to you, Faith. Did I get that right?
Yeah, Asante Sana. How do they say Asante Sana in Nigeria?
Thank you. You know, in Nigeria, we have different languages. So
In
in
Yoruba,
Yoruba, Eshe.
Ashe. They say Ashe or Eshe. Ashe.
Eshe, thank you. Eshe.
Okay. Eshe, I am also very much grateful. It was a good discussion. I'm looking forward to having more of this in future. And it was nice having you. And it's good that technology has made it easier for people to connect, because you are in Nigeria and I'm in Kenya, and it's so nice. Yeah.
Yes. Nice chatting with you. And thank you also. Thank you all for listening and tuning to Beyond Awareness Podcast with Adesola, where we amplify voices and drive change.